Takes 2 minutes if you're taking your time. Okay? This is an extremely quick skill. I think you have like 3 minutes or whatever to actually do the skill. It's all timed. But understand that even though there's like 4 steps to the skill, you see it on the skills book, they try to like add more steps in there, but you can't really add too much more to this. People still fail this skill. People still fail this skill for simple stuff. PSI, human safety. You have to say it at the beginning of every single skill. As annoying as it is, you have to say it every single time. You could still fail, okay? You still get 1 or 2 students every semester amongst all the dozens that we have that are testing that fail this skill, okay? They fail the non-rebreather skill. So don't underestimate it all the way, okay? So just be careful. So with any skill, standard precautions, staying safe. Okay, well actually just kind of talk about the tourniquet. When would you use the tourniquet? Simple enough. Stop.
So you can't control
Breathing
to an extremity.
the pressure.
So mostly talking about extremities, right? That are bleeding too much. What else? Or what else can you tell me about the tourniquet?
It's a cat Gen 7 tourniquet.
Okay. Like it. Cat. What else?
You shouldn't make it too tight.
You shouldn't make it too tight.
No.
That's kind of the point of it.
Per the book, it says put it to 2 to 3 inches above the wound.
All right, so we're going to put this 2 to 3 inches above the wound itself for testing purposes. You're just going to mention 2 to 3 inches above. For your actual test, it's not going to be anything weird. Okay, you have bleeding right here, 3.5 inches below, the armpit. It's not anything crazy. Okay, we're going to keep it pretty straightforward. We're not going to add any, sudden, okay, your patient goes to cardiac arrest. What do you do? Pretty epic, but that'd be terrible. So it'd be pretty straightforward. We just want to see you demonstrate the skill itself. All right, yeah, so 2 to 3 inches above the actual wound itself, you want to apply it. If that 2 to 3 inches lands on the joint itself, you go just above that joint. Now I know for military application, I know like our military that are in here, or Marines, I know they're taught to put that tourniquet as high up as possible. For the sake of this particular class, you're just going 2 to 3 inches above, okay?
They say 2 to 3 inches above or below.
The tourniquet?
Is what they
Put below?
That's what they teach us. Like if it's on the leg or something.
So you put the,
That's just what that's what the ditty is on.
that would make sense. Okay, anyways, I know, like when I taught the Marine class, they were all muscle memoried into putting the tourniquet as high up as possible, so we had to accommodate for that, because I had all 40 people doing that same thing, so they kind of overrode that. So like I said, 2 to 3 inches above, when you apply it, and you start to turn it, and I'll demonstrate it right now, when do you think I want to stop making it tighter?
When the wound stops bleeding.
So smart.
Boom.
Like that, okay? Not a trick question. So basically, yeah, when it stops bleeding. When it stops bleeding, that's when you ideally would want to stop, okay? So with these types of injuries, okay, what else do you think we're going to possibly be using along with the tourniquet?
Combat gauze.
Okay, so dressings. So our pressure dressings, the combat gauze, right? We talked about hemostatic agents. We're actually going to go over that today as well. Actually, if you want to grab those boxes, black boxes, and the other tables, set up like 3. So we're going to go over combat gauze here in a little bit as well. Okay. All right. So first thing, standard precautions, staying safe. You have a patient that has profuse bleeding to their arm. Your first action, you're going to take some gauze and apply direct pressure. Okay. Now, when it comes to applying direct pressure, remember what I said? You actually have to like dig into that wound and like find that artery basically from that wound. Okay. So direct pressure, and the proctor says it still bleeds. Okay. Immediately, we're going to go to a tourniquet. Okay. That's just quick. Direct pressure, it still bleeds, tourniquet, okay? Now you need to acknowledge or tell your proctor, okay, at this time I want my partner to take over direct pressure. Don't just say, okay, tourniquet, and then let go and don't even acknowledge it. That's the muscle memory we kind of talked about, that you would actually do that in the field, okay? So direct pressure, proctor, I want my partner to take over the direct pressure. Okay, so he or she took over. Now I want to grab my tourniquet. Now, with this tourniquet, first of all, you have to take the strap out of the buckle. Okay, now I know, like for law enforcement, some other applications, the strap will be okay to be left on like that. That's a whole different scenario. That's because you're being shot at and then you don't have time to mess around. For the sake of this class, you're going to unbuckle the strap. Okay, because if I have it buckled, what is my partner going to have to do?
The arm.
Yeah, remove pressure. So for the sake of testing, that would be technically a critical fail. Okay? So just for testing, just to get out of this class, okay, you have to unbuckle the strap. Now ideally, there's a plastic piece right here. That plastic piece should be over the artery. Okay? Should ideally be over the artery. So if anything, if it's not the end of the world. Okay? It's not the end of the world. But ideally, this plastic piece, because this is the piece that's actually going to be compressing down and pushing on that artery. That makes sense? So, but just get the tourniquet on. Okay, simple enough. So let's say the wound is right here, this little black mark. Okay, so I go right above it. Okay, let's say I find the artery. You're going to take that strap, and you're just going to feed it through. Simple enough. Okay. Now what you want to do is, ideally, is to cinch down on it as tight as you can. Okay, so once I cinch down on it, then I can pull that Velcro across. Okay, so now what I'm going to do is, I'm going to stop right about right here. Okay, does everyone see that? So stop right about right here. Now, I can take this dowel and I can start to twist it. Okay, I'm going to keep twisting it until it stops bleeding. Okay. So let's say I keep twisting it, and it stops bleeding. I'm going to take this dowel, I'm going to tuck it in to this little catch right here. Okay. Oops. I'm going to tuck it in. Take this strap. I'm going to tuck this strap in. Okay, it's going to go over that dowel. Now the reason why it's this long is in case that you're going to put it on the leg. Okay, obviously the leg's a little bit bigger than the arm. Okay, so it's kind of a universal fit. You're just going to go around. Now, once it's around, you're going to go ahead and put this little white strap. You're going to acknowledge, okay, Proctor, I'm going to write the time down. And I want to keep this exposed. Keep this exposed so that way anyone that walks up to this patient knows there's a tourniquet on. Okay? Now your proctor says, your patient is showing signs and symptoms of hypoperfusion. What are some signs and symptoms of hypoperfusion?
Lack of oxygen.
Tail?
Lack of oxygen on the.
Okay, so the whole body. Okay,
Yeah,
so
whole body.
lack of oxygen in theory, right? Because you're losing whole blood. So pale scans. What else?
Diaphoretic.
So diaphoretic.
Cyanide. Bad cap
Could be
refill.
cyanide. So delayed cap refill, right? What else is a good sign of hypoperfusion?
Altered mental status.
Altered, because you're losing pressure upstairs, right? What else? What about pressure?
Blood pressure would go down.
Yeah, blood pressure's down because you're losing whole blood, right? So what are they going to do to compensate?
Breathing.
Breathe faster.
So breathing's going to be fast, heart's going to be fast, okay? So you have to be able to list off several items that would be considered hypoperfusion, okay? Because the proctor may ask you, what are some signs and symptoms of hypoperfusion? Tachycardia, hypotension, fast heart or respiratory rate, okay? Pale, cool, diaphoretic. You have to be able to give all that. If you can't, that could be a critical fail because then how do you know that they're going into shock or hypoperfusion?
Does the systolic goes down or diastolic or both?
All the above.
Okay.
It'll all start dropping. Systolic will drop faster though. Okay, because diastolic will try to maintain because the heart will compensate some, so it'll maintain a little bit of that diastolic, but that systolic will drop faster. Okay. All right. So now that my patient's showing signs and symptoms of hypoperfusion, and let's say they were sitting up in a chair, what I want to do is stand them up on the ground, and you actually want to lay, hold on my neck. Okay. So you stand your patient up and you want to help them to the ground. This is the big one. You have to guide their head. You have, for testing purposes, you have to kind of grab their head and guide their head down because we just said they have a what? Altered mental status, right? They're basically starting to pass out. Now in theory, can they hit their head
Yeah.
on the way down? Yeah. So can we be the problem? Yeah. So for testing purposes, you have to hold their head and guide their head down and help them to the ground. Lay them down. You're gonna grab a blanket. Okay, at this time, I want to keep my patient warm. I want to keep this arm exposed so people know that there's a tourniquet. And I want to put the patient on high flow oxygen non-rebreather mask, 15 liters per minute. Put it next to their face. Transport. Okay? So that is the skill. Okay? That was 4 steps, right? In the skills book, how many steps is it? It's nothing, right? So, but understand, people still fail this skill. People still fail the skill. So make sure you try it a couple of times right now, at least twice. Okay? Questions? Cool. All right, so break off into groups of 2. 1 patient, 1 EMT. Grab